Zen Odyssey Food and Mood Coaching with Dr. Sharman. We are going to dive into hormones today because it is a big passion of Dr. Sharman's that she's really recently, we were talking, I don't know, a couple months ago, and she was saying, I'm really excited about doing this work with hormones. And so we've had this podcast, this live video on our to-do list for a while, and today's the day that we're going to dive into hormones. Do you want to share anything, Dr. Sharman, before I give you some questions?
Yeah, I'll just share that I feel like one of the most common things I hear is, the Western medical, the very general treatment for hormones is just to put women on birth control. And this is going to be geared mostly towards women, but that's what I hear. And then like birth control when women are young and just starting their menstrual cycle throughout their life, and then in menopause they pretty much don't address anything, and they just tell women to exercise more, eat less, go on antidepressant or anti-anxiolytic, and get therapy. Turn down the thermostat. Like these are the things I hear. This is very common. This is just common practice, and there's just a better offering out there, and that's why I feel so passionate. And people start birth control and these things, and they don't understand the long term effects of it. And so I just feel really passionate about helping women feel like there's an alternative. There's other ways. There's just such better ways of doing it. So that's my plug.
Yeah, I mean I don't know if you know this about my story, but like when I was 18, I had out of control periods. They were super heavy, super long. Like my doctors were worried about me getting anemic, and the solution that they had was birth control. I went on birth control for 6 months and I gained a ton of weight. I got super depressed, and I was like, I stopped it because I was just so miserable. It solved my period, but it made my quality of life go drastically downhill. So yeah, I'm one of those people who got put on birth control purely for like hormone regulation, and it wreaked havoc on my body for sure.
Right.
Yeah.
Or even just like acne regulation, right? That's their answer. It's their answer for everything for young women. And it's just not right. So
So actually, I'm curious. So what is the problem with doing with giving young women birth control? Like what can you go into, like what does it mean that it wreaks havoc on our body?
yeah, well, there's some long-term consequences. So certain hormones can be elevated long-term and they don't ever go back to normal. And one of those is called sex hormone binding globulin. And why that's important is that one, that's a huge component for helping regulate our sex hormones in women. And then also it actually can decrease. So it actually can like decrease testosterone for long term for women, which right, and then like a lot of times you hear of women having low sex drive. Well, that partly can be because they have these decreased levels of testosterone that even if you stop birth control, continues on. They don't see those things changing. My understanding is it also can shrink your clitoris as well, long term, some of these effects. And then also, it's just like women don't understand their normal cycle, then, right? They have no idea if their cycle is regular. A lot of women are waiting longer to have children, and so then they have no idea what their cycle is like. Maybe they stop in their 30s when their fertility is already starting to decline. And now, again, like I think out of the box, lots of women can have healthy babies in their 30s and 40s, but yes, your odds of, your fertility does decrease with age. And so then women are starting this process when they're already wanting to have children. And there's other things out there. I want you to be knowledgeable about your cycle. You want your cycle to be healthy. It's a report card you get every month. And if you're just putting a band-aid on that and forcing a certain cycle with birth control, then there's just so much knowledge that's lost in women. And then again, there's like better ways to do that, right? We can improve your liver function if that's what it is, or your diet, or just so many other things that can be looked at and benefited. And then, gosh, my train of thought. There was one other thing. Oh, and then also like women's cycles, like especially when they start, very young. When you start cycling in those first couple years, like your body's still immature and your hormone cascade is immature, and so it's going to change. So putting you on birth control again doesn't allow you to understand what's happening in your body or to track that at all. So
Yeah, I have a few clients that are popping to mind where they've like been on birth control since they were in their teens, and they're like just coming off of it. And that's actually part of what I'm hearing them say is like, I have no idea what it's like to have my hormones. Like, I don't know what it's like to have regular PMS. I don't know what it's like to have, yeah. And
Right, and how
What
old are they? Like, what's the age range kind of? Do you have an idea?
um so both of them are in their mid 30s.
Yeah. So, and are they wanting to get pregnant? Is that part of it, or?
There one of them is, and one of them is just more actually wanting to kind of like what you're
Just
talking about is like
clean
getting
up?
more back in touch with their body, is just like having that connection because there is a
Mhm.
disconnection with the hormones. And so it's like more of a holistic choice of like, well,
Yeah,
what
and
is my hormone cycle like?
sorry, specifically before I was kind of thinking of oral birth control, but same with like IUDs with progesterone in it, then women just aren't cycling, and that has its own problems as well. And then they're so disconnected, they have no idea. So, anyway, yeah, and I actually see like headaches being linked a lot to IUDs, progesterone IUDs.
Hormonal headaches, yeah. I'm curious, like on the other end of hormone health, like I was just talking with someone who was over at our house last night, and she was sharing with me that she's very excited to get a hysterectomy in July. And for me, like I know my aunt had one and she really regrets it because she didn't like I don't remember what her reason was for getting the hysterectomy, but she didn't realize all the implications. Like for one, I know that she like can't control her weight anymore. She's like always been like this really attractive thinner woman, and now that she had this hysterectomy a few years ago, she like basically doesn't eat and she's still gaining weight. And she's like, I wish I had done more research. I wish I had known like what kind of implications it was going to have. So maybe do you want to talk a little bit about what you see on the older women's side? Like I know one of the things that you and I have
Yeah,
talked about, like bioidentical hormone replacement. I know hormone replacement is like one of the things that Western medicine offers, and I know we've started a conversation talking about what that there is also an option for older women for
yeah,
hormone like natural holistic support.
yeah,
So you want to touch a little bit about that, like what's a hysterectomy
yeah,
and what kind of options are there, or what, or maybe
yeah,
we'll start with what the problems are of using normal Western medicine hormone replacement and hysterectomies.
yeah. So, I mean, you're the person that you just saw last night for dinner that's excited about their hysterectomy. Like, I just wish I could have gotten my hands on her like 10 years ago, right? This is a hormonal problem that maybe could have been prevented if we had been more in tune with our cycle or understanding more. And granted, some women just need hysterectomies. Maybe they have fibroids that are too large, or and again, like there's lots of natural things we can do about that. Hysterectomies can be amazing for some women. But that being said, yes, um, they can force women into an early menopause, which I'm guessing is what happened to your aunt. The trauma of it, even if you still have your ovaries and you can still produce the sex hormones from ovaries, it can still just the trauma of it all can definitely instigate that early. Then that's probably what happened. And so she's like a perfect candidate probably for some sort of hormone replacement therapy, which I do love. But I love it being a bioidentical. So yes, yes, the Western medical or like general medicine, yes, you can get hormone replacement. What I find with that falls into an umbrella called static hormone replacement. So there's like these two types of hormone replacement I think of. There's static, and then there's the physiologic protocol, which is something I just got trained in, and I'm super excited to share with you about. So, static
Ooh,
replacement is hormone therapy that is the same every single day. And these can both be bioidentical or not bioidentical. So, typically, what you're prescribed in conventional doctor's offices is the static approach, which is the same kind of low dose of estrogen and progesterone on a regular basis. And then it's usually not bioidentical. I think bioidentical is super important. I think I don't even understand why that needs really explaining, but obviously wanted to mimic our own natural hormones. And there's been many studies that show that using bioidentical hormones is very safe. A lot of the bad rap that hormone therapy gets is because they were using non-bioidentical hormones, and that created problems with people. It increased cancer risk, it increased some other things. And so bioidentical hormone is usually very, very safe. Obviously, we want to monitor it. Um, but I feel really passionate about it because it's so good at preserving specifically heart health, bone health, skin health, helping maintain a normal weight, all the things that happen with menopause. It makes women not have painful urination or painful sex. It can help with all of these things that we see as women's hormones decline. And it's important to start to know about it because the best time to start hormone replacement therapy is actually like either in perimenopause or right, in that perimenopause. So actually not waiting till your period stops. maybe it's getting irregular, or maybe you're noticing signs. And if I back up for a second, perimenopause can actually start, it can start years before your cycle actually changes. So you can be noticing that your cycle is changing in these smaller ways, or these, maybe you're noticing a little more brain fog, drier skin, joints that hurt. Your cycle is changing, but it's not irregular yet. Those are all signs that perimenopause is happening. It can happen 10 years before that like cease of period. And so we can use hormone therapies to augment our hormones so that we can have more youth for longer. And so back to that static versus physiologic. So I'm really excited about physiologic because I never understood the intricacies of the cycle as much as I do now. So it's important that like estrogen, if the estrogen part of the cycle is the first half of your cycle, the progesterone part is mostly the second half. Estrogen has this like big uptake around day 12, like increases dramatically. And this this big curve that happens with estrogen is really important for doing all sorts of things in the body. So that spike helps our body stop breakdown of bone and increase bone health. So there's been studies that show that people who do this physiologic restoration, where they get that spike again, helps build their bone back. So maybe they have osteopenia, and that osteopenia goes away. Their bone is being rehabilitated, and it's happening again. Um, it's also really good at stopping like excessive tumor growth or like cell proliferation. So in the breast tissue, it can actually be anti-cancerogenic to have that big estrogen spike, but it has to be in a way that makes sense, right? We're not giving a high dose estrogen all along. Where we need that spike, and that's what's so different, is getting these spikes and getting them the subsequent effects that happen in our body is huge. And you don't see that happen with that static hormone dosing, which is the same dosing every day. So I'm super excited about
Cool.
this. So the estrogen, you it's a pain. Like, I'll be honest, the protocol is a pain in the ass. You have to do creams like twice a day, and it's going to be different to mimic the cycle. But because of those nuances, we get to see these much better results. Maybe we'll come up with better ways of doing it in the future. Those are the tools we have now. So that big spike of estrogen is important, and then you don't really even do progesterone until the second half of your cycle. So then you'll have progesterone the second half of your cycle, and you'll be playing around with estrogen and progesterone creams. Again, there's a big spike around day 21 of progesterone. And so we can really see that we're mimicking the natural cycle of a woman with giving these certain doses that aren't static, that are mimicking again those ebbs and flows of the hormones in our body. Again, we get to see these subsequent super cool results. And for better or for worse, women are still bleeding as long as they're doing this. So a lot of women like hear that and they shut down. They're like, nope, I'm ready for my cycle to be done. But I think if you can understand the benefits of why, and if your cycle isn't super heavy, if it's not painful, you're not PMSing before, you're not turning into an angry person, then you can be okay with having a period for longer.
Yeah, and wow, there's so many that yeah, okay, so I have a few questions.
Yeah,
One is, so my understanding, and this is, I'm going back to actually one of your previous comments, is like that our period is kind of like, our menstruation is kind of like a report card. And so one of the ways that I really like to look at it, also like poop, like I'm looking at my little kid's poop or dog's
absolutely.
poop to see what's going on inside the body. And so like our periods are also like a time to see what's going on with our hormones. And so what like I when I like to think of my own body, or also like my client's body, when we talk about menstruation, is like, if like it's a painful or like rate, like, or also the high irritation or the PMS that a lot of people associate with it. For me, what I categorize that as like something's off, like like our body, her body is not, so they're like messages or signals from our body that like something's out of balance. You would agree with
Absolutely.
that?
Yeah. Yep.
So like if we're balancing the hormones, and if everything's in balance, our periods shouldn't be this horrible thing. Like, I know some women are in pain for days, some women are, like they have to be in bed or they get migraines, or then those are all signs
Yeah.
that like their hormones are off. Those are not like a healthy period, right?
Yeah. Absolutely.
And then I
Yeah.
had
So
another.
A healthy period, right, is one that, like, you don't know is coming. It comes without, any of those mood changes, breast tenderness. Some people get itchiness, the vaginal itchiness. Some people get maybe a little bit of change in bowel movements before their period. So yeah, we want it to come. We want your period to be not painful. We want your period to not be excessively heavy or not be excessively light. Average 4 to 7 days. Yeah, that's a healthy period.
Nice. And that's the A plus progress report. Oh, you froze a
Can
little
you
bit.
hear me?
I heard no, you froze for a second. A what? A plus?
I said, yeah, A plus, absolutely.
Nice. Okay, and then so I think this might be a good spot for me to bring in. So for those of you who don't know, Dr. Sharman is one of my doctors that I work with and consult with on my health. And she actually just ordered me this. Well, she gave me this massive list of labs to take to my Western doctor to order them to see. And it was so funny. My Western doctor was like, "Well, your other doctor's gonna have to read some of these because I don't know how to read some of these labs." And we had like a nice. She's this really cool Indian woman. She's great. And so you made me think of one of the hormone. You told me that you suggested that I get these labs tested on day 12 of my cycle, probably because you're wanting me to measure my estrogen on day 12.
Yep, you got it.
Cool. So I'm excited to see my what's going on with my hormones. And yeah, I've
Yeah,
been using my hormones have been the last couple of years, and I think a lot of it has been stress induced, but it might also be age. But my periods have been not. I've been maybe getting like I don't know B minuses, C pluses. Not I've been getting A pluses the last couple of years. Um, I'm curious, like what are the different like what? So for me, and then this is largely because like I've had really good success with Vitex and Black Cohosh, so that was like what we went with for me. I'm curious, like what are the general things that you offer people for
yeah,
hormone health? Like
yeah. It's a good question, and of course, with this type of medicine, there's no one answer. But it depends on like kind of the severity. But first, I always clean up make sure their adrenals are supported because it's all right. So stress affects your adrenals. Adrenals is what affects everything, and so if that's not on, then everything is going to be influenced. So a lot of times I'll start with just the basics. Clean up their diet, help support their stress, make sure they're
Would
sleeping.
will you go into just a little bit of what the diet is? That what do you suggest is clean up their diet?
Yeah, I mean, kind of like what you're doing, like stopping, well, the basics, right? At first, at least the basics. Cutting
Sugar,
out
flour.
any junk food, sugar. I don't always cut out flour at first. Not everyone's ready to hear that at first, but cutting out the big hitters, like if they're drinking soda, get rid of the soda. If they're drinking coffee with like crappy creamer, right, with all the chemicals in it, like getting rid of those big hitters. Obviously, going.
What do you think about hydrogenated oils? Are those a big effect on the hormones?
I mean, I don't know about specific for hormones, but I think in general, like for people's health, absolutely, yeah.
Well, and the liver
But
too, right? Like hydrogenated oils are tough on the liver, and if the liver is trying to be
yeah,
optimized for hormone health, then it's like maybe an indirect link.
absolutely. I mean, so a lot of times, I'll prescribe something just for people to get an idea, like the Whole 30, something along those lines, right? Just cut out the crop. Um,
So
so
you
supporting
said
stress.
hormones, diet, and then you started saying sleep, and I interrupted you.
Oh, making sure people are sleeping, and sleep can be a little tricky because if they're like more in that perimenopausal stage where they might be needing more hormones, then adding in hormones can really help with the sleep, but doing what we can around their sleep hygiene, right, which means like making sure it's dark in your room, not having blue light before going to bed at kind of the same time. Earlier is better than later. um, and then blood sugar, and blood sugar obviously goes along with diet and like lifestyle, but blood sugar is huge to regulating hormones. If we look at like people with like a PCOS sort of syndrome, which is polycystic ovarian syndrome, for those who don't know about it, like one of the main treatments for that is just like managing people's blood sugar because that has effect on the ovaries and everything else in the body. So looking at all these things are so important with getting just basic hormone health in place.
How much do you know, with the blood sugar levels, is it the spike in the blood sugar level, or how much of it is the blood sugar level spike, and how much of it is the inflammation caused by, like, a heavy sugar diet? Do you know?
Hmm. Um, well, I mean, I think those are kind of two separate things. So yeah, I think like the inflammation is definitely not helping and it's contributing, but I think that people still can have blood sugar issues even if they're eating like a not inflammatory diet. So I think they're kind of two separate parts. I think the blood sugar it's spiking either low or high, right? Because some people right have more hypoglycemia and um, it's a pet peeve of mine because a lot of times regular physicians don't look at that, right? They're like, oh, your blood sugar is nice and low, you're healthy, but that's not healthy either, right? People feel like crap when their blood sugar is too low. So really just making sure that it's your blood sugar is not going like this. And obviously we want it to be more, ideal numbers as well, but it just make those highs and lows are really problematic. And so my biggest treatments for that is like stress support because stress is huge for that. Stress will increase your blood sugar and make it spike. And then eating regularly is huge. So for people who have lots of spikes, I don't recommend like a hardcore intermittent fast. Obviously, not like snacking at night, but they really need that like breakfast, lunch, and dinner. Sometimes even a snack in between. But the better you're doing at getting like good fats and proteins in those meals, the less you should have to have those middle snacks. But that's huge. And I actually find blood sugar, especially for women, starts being an issue in their 30s. I find just living in modern society, you're already going to start having blood sugar issues. And then it definitely goes wonky around the perimenopause, menopause time. But just getting people's blood sugar, like these are the things I hear patients say. Patients will be like, I'll just treat their blood sugar. And they'll be like, oh my God, Dr. Sharman, my life, like you gave me my life back. They have, like, people have no idea how much it can cause the brain fog or the fatigue, um, shakiness, just like generally feeling unwell. So blood sugar, like those things are so huge to cross off to help to make sure your hormones, the hormone replacement stuff would come later. Like this is foundation. This is what we need to build. I'd say like 50% of my patients like feel better just with that stuff. And then from there, like maybe we'll use some botanical medicine like you like has worked for you, right? A little bit of Vitex is very common, very helping more for like the progesterogenic. Black cohosh as well. Maybe maca is another favorite of mine. Um, and then there's obviously like supplements that can help with all of those things too, like blood sugar, breaking down estrogens. We can focus on. There's lots of different labs we can order to kind of assess that. But so like yeah, it starts comes with lifestyle diet. We can use some herbs and supplements, and then we can use like hormone replacement as well.
I'm super curious. Will you talk a little bit about, I don't know anything about the bioidentical hormones. So what does that look like? That's totally new to me. And I'm also very curious about it.
Yeah.
Is it like a supplement that you take every day, or is it the creams you were just talking about?
Yeah, so bioidentical hormones can be prescribed in different ways. So, classic, I feel like people classically like know about like estrogen patches. That's hormone therapy. So there's different ways. You can do transdermal, which is patches. You can do creams, which is transdermal going through the skin. There's oral, but that's not considered the safest form. I usually only do oral progesterone. Estrogen, we definitely want to make sure we're bypassing the first phase metabolism. So bypassing the liver, that makes it much safer. So creams are the safest way to go, hands down, or like a patch. That being said, the oral progesterone, so progesterone sometimes I'll do orally because most of it skips that first phase, but some of it doesn't. So it's case by case, but it has more of that like help with sleep. And so if women are really not sleeping, I might give them orally for the sedative effect. Or if they're just like, hell no, I'm not putting that much cream on my body, right? Then like we're gonna find a different way of doing it. But creams definitely have the highest safety profile. So I try to get women to do creams. You do have to be careful because you don't want to pass it to a partner or a pet. So timing can be tricky, especially with intimacy, or small children. So creams aren't for everyone, and that's why we have lots of options. Um, yeah, we definitely don't want to be putting lots of estrogen cream on our inner thighs and then engaging with intercourse with a male partner, right? That would be a
Giving
big
him
no
more,
no.
giving him
But you
estrogen
can
he
try.
doesn't need.
Yeah. You don't need that in those places. So okay, so bioidentical hormones. So there are different forms of them. Um, they're all bioidentical, right? So they're mimicking our natural molecules, our natural hormone molecules. They're augmenting it. You wouldn't want to do this in someone who's young because it would shut down your native production of hormones. So this is really just for replacement or augmentation at a certain age. I do use like natural progesterone for fertility a lot. So in younger women, when um, they're desperate to get pregnant, maybe they've done all the other things, they still have low progesterone. We don't have time to work on it, maybe. Um, Progesterone can be amazing, specifically for preventing like miscarriages in the first trimester or just plain infertility. I've had amazing results if that's the problem, and it's not typically tested in conventional medicine. That day 21 progesterone, I like to see it around 20. And I had this one patient, she was young, like in her 20s, not getting pregnant. We did everything. And I was like, we haven't done a day 21 progesterone. Let's do it on you. And hers came back at like 0.01. And I was like, damn, like and then she like got on her progesterone and she conceived naturally as twins, like the next cycle. And those are the kind of success stories I hear with if it's a progesterone problem that women aren't getting pregnant. Yeah,
Wow.
like such a cool story, right?
Wow, such a cool story. Wow.
um, Yeah, so did that answer your question?
Totally, yeah. So what are some of the other like cool stories? Because like I think sometimes I mean I feel like there's the general talk is like infertility is going down, people are needing lots of help getting pregnant, like sex life is off, hormones are off. So like I think that's kind of like the general it's hard. It's just and also even it's kind of normal to have really bad hormones. So, like, to give people some hope and some like juicy stories, like, what would be some like cool results like this story that would like kind of like
Yeah,
instill that like it's possible like to actually balance the body?
yeah. I mean, I just see all the time that women come in, acne, that PMS feeling like they want to kill their partner or their children, and all of those things going away. I think that like one of the coolest things that excites me is like, especially again in like that more menopausal sort of time frame, but like again, like the modern medicine wants to put you on an antidepressant and anti like anxiolytic. Um, and then like so the typical thing that I see with menopause is like cholesterol starts going through the roof. Their blood sugar starts like having issues with that even more so. So that mid weight gain is part of that. Um, Vaginal dryness and like the urinary irritation specifically. Like a side note, specific little story about that. I had this woman who'd been using an E string, which is like a little estrogen ring that you put up in the vagina. She'd been using that for years to try to help her urinary irritation with every urination, a painful urination all the time. It didn't really help, but she kept it in. And I was like, well, why don't we try just like some bioidentical estrogen? They now make it in these little like suppositories that are like little tiny. They're called inserts. So it's not like this messy cream. Because I hear women like there's someone who still put these like messy creams all up there all the time. That's not fun either. But I was like, why don't you just try this? And I honestly didn't know if it was going to work because I like, she's already on the E string, like that should do it. But like gone 10 years of like urinary irritation, a week of doing this like natural estrogen. I mean, amazing. Again, like you gave me some of my life back, right? I don't have to worry about this all the time. Um, so that's kind of the typical, and I think like the bone thing is like so cool. Like women can actually like decrease and build their bone back up, which is huge. Like there's no option, and nothing can do that. I think I've never seen anything work like that except like some of this hormone therapy. So that like kind of anti-aging to me is like, I mean, that's like a miracle.
I know that a lot of older women, somebody actually commented, I did a post a few months ago about gaining 5 pounds, and somebody commented, like, well, just wait till you hit menopause. There's nothing you can do. And I was like, oh, that's one like thought about it. So I know a lot of women are like really concerned about their weight in menopause.
Hmm.
So do you have any success stories that come to mind about like doing this bioidentical hormone replacement and having I mean, I know you said it. You said that that is one of the effects, but like, do you have any like cool stories?
Yeah. So the physiological restoration is a little bit new for me, and so I don't have as many success stories with that. I mean, in the training that I've gotten, I've heard of success stories, The weight is huge, and that's why a lot of women seek out the doctors. But this new protocol, I think, would really benefit most women on that. The key is that you want to start it before some of these changes ideally take place. So, 10 years post menopause, it's really hard to start this protocol. So, I would recommend it ideally just right when your period's starting to change or a few years after. Um, and the biggest problem with that is because we give high doses of estrogen, right, that are mimicking a young woman's cycle. And so high estrogen, if you've already have some of like coronary artery issues, so what happens after people go through menopause is their cholesterol spikes, they start getting more deposits in their like and plaquing in their arteries. Now, if those are hard plaques, it's not a problem, but if they're soft plaques and you give them estrogen, you can dislodge those soft plaques and then create further risk of stroke. And so um, we can minimize so many of those issues. Like the number one cause of death in women is cardiovascular disease. And so if we can help prolong that and mitigate that, like that to me is like such a huge success story and gets like a big celebration. Um, but it gets really hard. So if women come into me and they're 72 and they're like, I just found out about bioidentical hormone, I want to do it. The only way I'm going to start something aggressive like that with them is if they have like a coronary artery calcification score. Like I'm going to make them do a bunch of tests to make sure their risk is zero. And that's the only way I'm going to start them on that. But if they are started on that, like you see women's cholesterol is lowering without them changing their diet or their lifestyle, right? That's huge. That's just giving them like their hormones back and their youth back. And so it's just amazing.
Yeah. Yeah, I want to ask you a question about men first, next, but I first wanted
Yeah.
to comment, like, I think, you know, oftentimes we see like sexy being like displayed and like how beautiful like sexiness is, and like I really think that a lot of people like miss the connection of that sexiness is really health. Like there's a reason that like we're attracted to health, like healthy looking people, and we think they're sexy because they're healthy and they have their hormones and they have the resources to reproduce, right? So it's like I think that's like a I don't know, I just really connect that dot of like for me it's like you could wear lipstick and do things on the outside to look healthy or do botox or do, whatever it is, or you can really invest internally like with hormones to really get our body to like a really healthy, which I love that you're connecting like the whole anti-aging to this, like so it's how do we support our hormone health in our body that keeps our vitality and ultimately our health, for longer in our body, bone health, all of the different components, skin, like, having beautiful young skin, it's like it's healthy and sexy because it means we have I like to think that we have internal resources. And when we
Yes.
when
And
we're
I'm trying
lacking
to
our
use
hormones, we don't
go
have
ahead.
them. Go ahead.
I'm trying to use the term aging gracefully because I think
Yes.
anti-aging is unnatural. So we're just working on aging gracefully because there's so many beautiful
Yes.
aging. Yeah.
Yes.
Side plug.
Yes, that takes me back to San Luis Obispo, actually. That is where I realized in my early 20s that I wanted to age gracefully. I saw a few older people around me who were like looking very good and
Yeah.
very vital. And I was like, what are you doing? You're doing yoga, you're eating clean, you're managing your stress levels. Like, and I was like, I want to do that. I want to be one of those people who ages gracefully. I love that you brought that in. That's cool. So what can we do? I know that you don't like specialize in men, but like what can you kind of give for the men in the crowd? I'm actually also really curious about my partner because he has some high cholesterol, which was partly like what just like spurred the question. Do you work with
Yeah.
men? Like what can you give us about men in this field?
Yeah. I mean, there's a whole epidemic with men and low testosterone happening. Um, Stress is a huge part of it. I think or like exogenous estrogens, so estrogens that are in our environment impacting increased estrogen in men's bodies is huge. So all the basics apply to men as well. Like your digestion, we didn't even talk about digestion, but like digestion is huge for getting rid of estrogens. If you're upcycling them, that's a huge problem. So all the basics. Blood sugar is huge for men, and control as well.
Can we just pause there real quick? Because I think you said something really important that maybe people didn't catch. So upcycling, fill in the gaps of, so just like put into layman's term, upcycling is like our liver is dumping the hormones and getting rid of what we're not using. And like ideally our digestion is moving regularly and everything's going out, which
Yeah.
means like we're not constipated, there's no impacted stool, because when we are constipated, there's impacted stool, then we're reabsorbing whatever in our intestines, which could potentially be hormones. Is
Yes.
that
Yeah. Yeah.
okay?
You nailed it. And they've done studies on it. Like you can see via studies like that the estrogen is being reuptake. So what you tried to excrete is actually being sucked back into the body and reutilized, and so that creates its own issues. So that's huge for men as well. Um, I mean, I think I don't think testosterone replacement is a bad thing for men, but I think it's really important to work on the basics because a common thing I'll see is like um, men can aromatize or like change testosterone into estrogen. And so if that's the problem and they're just changing their testosterone to estrogen, we need to do something about that, not just give them testosterone. It's just going to make them have more estrogen and their testes are actually going to like shrink. I've seen this happen to a patient. And so being really mindful about nutrition. Nutrition is huge. You need lots of different cofactors to make all the hormones and have those things happen in an appropriate way. Um, I don't know. Let me do a little research and we can do a whole other one on men's health because I know a lot of things. I just didn't like, just, I don't know them off the top of my head as well.
Okay.
But
Yeah,
yeah.
I would be really interested. I know that I feel like there's a lot of information on women's hormone health, and I think, yeah, I know that men's it's much harder to even track because they don't get that monthly what did you call it, report card. They don't get that like sign of like you can't ask a man, so how's your period? You know, how's your menstruation, which is such a good indicator of like what's going on hormonally, and so it's harder I think with men to
I mean,
track it.
I would maybe
No,
argue it's actually easier in many ways because it's not as nuanced. So you don't have to time things, right? Like women, I'm like, do this on day 12, do this on day 21. That's challenging. With men, there's less variables. And so it actually can be easier, I think, to treat men.
cool,
Yeah. Yeah.
cool.
So yeah, we'll
Okay.
have to do another one and I'll
Cool. Let's
brush up
do
on
another
it.
one on. Yeah, that would be great. I would love to do one on
Yeah.
men's.
I mean, the one thing I will say for men's health is just that um, testosterone, I feel like gets this like general bad rap, right? Like too much testosterone will make you aggressive, right? But they actually found that low levels of testosterone in men can actually do that as well. And that giving like both estrogen and testosterone are actually like very natural calming in the right measurements. And so I know some women are scared
Imbalance.
of estrogen or scared of testosterone, and like they're such beautiful hormones, and when used correctly, they can have these really wonderful effects. So, like, just because you take testosterone doesn't mean you're going to turn into like a rage. You know, you're not going to have rages per se. Some women might, but like it can also have these really wonderful mood, brain health
Cool.
effects. Yeah,
Nice. So that's exciting. Cool.
yeah.
Okay. I would like to have two more questions for you. One is, what do you do for your hormone health?
Mm.
Are you? Tell me. Yeah.
Yeah,
Tell me
so
whatever you
I
want to share.
am honestly, I don't take anything specific for my hormone health. I find for me eating well, like the cleanse that we're doing has definitely made my hormones much better. I'm getting less breast tenderness, um, no spotting before my period, no acne. So I mean I honestly like for me changing my diet, making it better, improving my stress, sleeping, and then can't remember the other thing, exercising, right? Exercising and like moving your circulation, moving your lymph is huge. And back so the other day, I was like, I don't remember how lymph works. But lymph works very similarly to our blood. So it's going to be dumped kind of the same fashion. It does go through different routes. Um, there's different, little channels as it spreads out to the tissues, and there's major lymph organs. But anything we can do to just getting basically circulation, right?
Movement. Yeah.
Yep.
100%. So is that those are the things that you do? Is just like
Yeah.
nice. Cool.
Yeah.
Okay.
Let me put so one thing I do find amazing for women, and it's so easy, is called seed cycling. I have a blog that I'll share with you, and maybe you want to put somewhere for people to access. But seed cycling, I would say, is like one of the easiest things you can do. It's eating different kinds of seeds the second half of your cycle. And I see some amazing results in my practice with women just incorporating that.
Yeah, I remember reading that post. It's a really great one. I think I tried it and I didn't see results, but
Yeah.
maybe I didn't
Some,
try.
a lot of,
I don't quite remember. But yeah, it's
it
a
probably,
great post. Yeah, please do share that one.
yeah.
Okay, so I feel like I had two more questions, but I want to have one question that I want to ask you because I'm gonna be doing my estrogen test on day 12 next month after we finish our detox because that can
Uh-huh.
mess with like labs and stuff. And so I have a question that I think maybe so I do so oh that was my other question was birth control. So I have an IUD, as you know, and I spot like before and after my period. So how do I measure day 12?
So
For,
what, but you have a non-hormonal IUD, correct?
correct, I have a
Yeah.
copper one. Yeah.
Yeah, so that is my very favorite form of birth control, just putting it out there. Spotting is usually just like day one. Usually I count like the first spot as day one.
So even if I spot for like 3 days and then I have like 4 day period and then I spot for another few days from the first spotting day.
I usually do, yeah. If you really feel firmly that like that full bleed first day, then you could count that as day one. But typically I'll say day one of spotting.
Okay.
I mean, we could always consider doing a blood draw, day 3 days before and 3 days after. We could always consider doing one on day 9 and day 12 just to see. There should be a significant change in the estrogens. We could always do something like that.
Maybe we can do day 12 and see what the results look like. And then
Yeah.
if it's funky, then we can
Yep.
do some more.
Yeah,
Yeah.
we could do that. Oh. Yeah, and like just I know we only have a couple more minutes, but like there are many ways to testing hormones. I used to always do urine hormones, which I think is a great way. You can get really nuanced about metabolites and how things are breaking down. But I really like. I've been trying to switch to using serum labs, just blood, because number one, they're typically covered by insurance to some extent, and most of the research articles are based on those. So I think they both have merits, but I'm really trying to switch to something that's a little bit financially easier for patients, and then there's more data around it.
Nice. Yeah, it's such a powerful thing we have like access to actually like looking inside of our body and knowing what the numbers are and looking at these labs. It's such a great tool and yeah, I love there's a couple of labs that my doctor wasn't able to order, so I want to talk to you about those.
Yeah.
But it's worth it to like pay out of pocket and know what's going on. It's like such a different set of information to be able to use.
Yeah, it's exciting. I love report cards.
Nice. Do you have anything left you want to share?
I don't think so. I mean, obviously, I could talk your ear off about all of it, but I think that's a pretty good overview.
Yeah. Yeah, I think that was a great start. And so if there's anybody that has any questions, please feel free to write some questions below here and we'd be happy to do another podcast on hormone health with any kind of specific questions. And I'll put a link to, oh, did you go
I'm
away?
frozen. I don't think
Oh,
so. Can
I
you hear
hear you.
me?
I hear you.
Oh, yeah, it's frozen on me too, but I'm here.
Okay. So yeah, if anybody wants to ask me questions, I think that I had a blast doing this and I would love to do another one. And I will also put Dr. Sharman's page if you want to reach out to her and start talking about hormone health. And if you want to make stress and food changes, let me know. That's what I do. And have a beautiful day. Thanks, Dr. Sharman.
Yeah, have a good day. Sorry I'm frozen. Bye.
Thank you. Bye.
Bye.